In healthcare settings, the right technical solutions can enhance patient care, reduce administrative burden, and promote care coordination. InterSystems Payer Services is a set of cost-effective solutions that helps your organization achieve all of this while complying with government rules and regulations, like the CMS Interoperability and Prior Authorization Final Rule, known as CMS 0057. Two specific areas in which InterSystems Payer Services can increase efficiency and reduce administrative burden in healthcare are electronic prior authorization and data exchange. Let's take a look at each of these use cases. Prior authorization has typically been a lengthy and time-consuming task, relying on manual methods like fax and phone. Electronic prior authorization streamlines the process, and InterSystems Payer Services enables this shift by providing the capability to handle electronic requests and ensuring required information is clear and accessible to providers at the time of need. Its flexible set of components streamlines compliance and improves provider collaborations for electronic prior authorization. Each of these modular components connects to your existing back-end systems and provides necessary FHIR support, routing, and data transformation capabilities for seamless exchange of prior authorization data with providers. One of these services, Coverage Requirements Discovery, or CRD, allows your organization to share coverage rules and decision support information directly with providers at the point of care, enabling faster coverage decisions and reducing unnecessary prior authorization claims. The CRD service acts as a CRD server that clients, such as EHRs, can communicate with to obtain information on care coverage. Next, the Documentation Template and Rule Service, or DTR, makes it easier for providers to submit complete and accurate information for prior authorizations. DTR enables you to define and communicate documentation requirements to providers in a computable format, often in the form of questionnaires that include logic for pre-populating responses. The third service, called Prior Authorization Support, or PAS, allows you to connect your existing back-end systems to provider systems electronically, enabling efficient submission and processing of prior authorization requests. Additionally, PAS supports data transformation between FHIR and X12. This service also supports metrics reporting, tracking the number of prior authorization requests and their outcomes. In addition, subscription notifications through this service can be configured to send notifications on status changes of prior authorization requests. All data passed through these services follows the HL7 FHIR DaVinci implementation guides, ensuring your organization is in full compliance with CMS regulations. Beyond the improvements in prior authorization, InterSystems Payer Services also supports improved data exchange and compliance with CMS 0057 through 3 FHIR APIs: Patient Access, Provider Access, and Payer-to-Payer. It does this by acting as the FHIR repository and server needed to receive and share data according to the CMS specifications. Let's take a closer look at each of these APIs. The Patient Access API enables members to view their own data through authorized third-party applications. This includes data such as previous claims, prior authorization requests and status, and clinical data maintained by their health plan. With access to this information, members have more transparency into their own medical care. The Provider Access API gives a member's provider secure access to the patient's data held by the health plan during their treatment relationship. This includes clinical data like past tests and treatments, as well as claims data and prior authorization statuses. Access to this data ensures providers have a more complete patient profile and helps to avoid issues like duplicate tests while improving the level of care. Finally, the Payer-to-Payer API allows the sharing of member data between health plans. For example, a member may work with 2 different payers or need to switch to a new payer. This API allows health plans to access clinical and claims history from other health plans to ensure continuity of care, avoiding duplicate tests and making sure necessary treatment occurs. These APIs ensure that key health and pharmacy data are available at the time of need, following standards like the United States Core Data for Interoperability, US CDI, the Common Payer Consumer Dataset, CP-CDS, Karen Blue Button, and Da Vinci guidelines like Payer Data Exchange. With InterSystems Payer Services, you gain a flexible, future-ready platform with built-in data transformations, standardized FHIR support, and proven interoperability, helping your organization meet today's CMS requirements and stay prepared for tomorrow's innovations, all while improving the healthcare workflow for payers, providers, and members.